Hello and welcome. Virtual Reality Medic here. Really great question came in on TikTok about cranial and spinal injuries, and that's what we're going to talk about here in the anatomy room right now. We're going to talk about some cranial and some spinal injuries. So the cranium is basically the cap that keeps your brain all in the place where it's supposed to be, and this is not an area that you really want to get injured. So you can feel it on your head where the skull bones have actually come together. They fuse together as you grew, and those are called the sutures. Now, those areas are prone to some injuries because there's sort of that like slightly weakened line there. So they are prone to some injuries, especially if you whack your head on something or something like that. There are some areas, the temporal areas, which are on the sides here. Those are a little bit more prone to injury as well. And then what's really the main problem, the main issue is that if there's injury to the cranium, there's potentially injury to the brain. Now, there could be injury to the brain where the brain starts to swell. There could be bleeding within the cranium, and that's not good because that's going to increase the pressure inside the cranium or an increase in intracranial pressure, okay? Now, in this, I'm not talking about facial fractures or anything like that. So if you're saying, hey, what about Lafort fractures or anything, I'm not talking specifically about facial fractures. We're just covering the cranium and the spinal cord here, okay? But really the cranial injury, believe it or not, is not as much, the cranial injury that's sort of the most dangerous, believe it or not, is not necessarily up here to the cranial cap. It's to the bottom part called the basilar skull, okay? So the bottom part of your skull, it's kind of inside your mouth and inside your nose area here, right? So down in here, that is the area where it is most prone to damage and most prone to injuries, the basilar skull. Let's take a look inside that basilar skull. Here we go. Going into the basilar skull. So there's a couple of problems in here. If we look at the basilar skull itself, wow, that is a super bumpy area in there, and you have your brain that's sitting right on top of that. And so if the brain is moving around in there or shaking around in there, it could also be being damaged by raking across that basilar skull. In terms of injuries to the spinal column, yeah, wow, we don't want injuries to the spinal column because there's a highway for our nervous system running right down these vertebrae, okay, inside of them, actually inside of them. Take a look over here. Look at this. That's the spinal cord running down inside the vertebra, okay? So if there's damage to the vertebra, maybe the vertebra is broken, something like that, there can be damage to that spinal cord. There could also be an increase in pressure inside here because covering the spinal cord is sort of a lot of fluid, and that fluid could increase, you could get an increase in pressure inside that fluid, and that can cause a lot of damage too. And it could be after having an increase in pressure over here as well that can cause some increases in pressure in that cerebral spinal fluid, okay? Damage to the outer portions is not as much of a concern, right? These they call the spinous process that are coming off of here. That's not as much of a concern as the concern for damage to the areas very close into the spinal cord. And then there's also jelly-like sacs that sit in between each of these, okay? And you can kind of see them on here. There's these jelly-like sacs that sit in between each of these. And if they rupture, they can impinge on the spinal cord as well. Okay, the weakest parts of your spinal column, the parts that are most susceptible to damage, right here. This is called the cervical spine. Okay, the cervical spine, really prone to damage. You can see you got this bowling ball sitting on top of a stick here, basically. Okay, and then down here, the lumbar spine. I wonder why the lumbar spine and the cervical spine are most likely going to be the places where we're going to have injuries. Oh, yeah, because we've got ribs protecting this part of the spine, which is called the thoracic spine. And then we've got the pelvic bones that are protecting this lower part of the spine. This is called the sacral spine, and then our coccyx bones down here as well. Okay, so when we're talking a lot of these injuries, we can get that sort of back and forth injury, so hyperflexion and hyperextension injuries, and we can also get those lateral injuries, those left and right injuries. And what's going to happen is that's going to determine what type of break we're talking about on the spinal column itself, and therefore where that pressure is going to be. That pressure can even be on the little nerves that are coming out of, right out here, see those little nerves that are coming out, and those nerves are going to every part of your body, because remember, this is the highway, these are sort of the back roads out to the body, okay? And if there's damage to the back roads, getting back to the highway is not so easy, okay? So keep your head safe, keep your spinal column safe. Ways to do that, obviously, watch out for falls, wear seatbelts, all of those kind of things. Just be safe. Just be safe out there. I really, I just want everybody to be safe. Okay? So take care of yourselves. All the best to you, and I'll see you on the next one. We got some more coming. Cool. Wow.